should be streamed. We should get everything.
My name is Chris Shelton. I'm the president of the International CWA Union. All these folks are here today, all my members and all the locals from California are here today because we've been bargaining with AT&T for a year now. As of today, it's 1 year we've been bargaining, and this is a company who can easily afford to do what we want. They make $1 billion a month in profit. They are continually sending jobs overseas, which is a particular no-no in the United States these days.
Isn't Trump, has he supported your fight against outsourcing?
I don't know. You'll have to ask him that. We have a bill before Congress right now about call center legislation, which would tell people when they call in, when they get somebody, where those people are. And if a company is sending those jobs overseas, which many of them, including AT&T, are doing, they would be able to ask for someone in the United States, or that company would not have the right to get federal contracts, which they all do now.
You're saying taxes are being used to outsource or funding companies that outsource their jobs?
Well, yeah, they're outsourcing jobs. It's not necessarily taxes, but they do have federal contracts, and they're sending jobs overseas. And what happens in these call centers when you send jobs there is that people are making such low wages that they do things like identity theft to make up for the income that they're not getting. So consumers in the United States are getting screwed by these companies because they want to make more profits. And that's part of what's happening. The other thing is that AT&T in California is not doing what they should be doing to make sure that internet speeds and the copper telephone lines are kept up so that people have the ability to use the telephones that they're paying for and the internet that they're paying for.
This is a question because in Korea and other countries, they have higher internet speeds, they have broadband for all the people. What is going on in this country?
You noticed that too, huh? We've been saying that for years, that, the United States is like number 30 on the list of countries in the world when it comes to broadband speeds. And it shouldn't be that way. We're the richest country on earth, and yet we have the richest telecommunications companies on earth, and they will not provide high-speed service to everyone, which should be a right today.
And people need it for their jobs.
Absolutely.
Their children need it for education.
Businesses need it. People need it. Kids can't really get through school without access to broadband. And you continually see redlining in areas where kids need it most to do their schoolwork. They can't get it because companies like AT&T and all the others just refuse to go to the neighborhoods where people need it the most because they can't make that God almighty dollar.
So that's one of the reasons the United States is behind as far as internet access?
That's absolutely why it's behind.
Now, recently at the University of California, they outsourced some tech workers. They're trying to outsource workers at public facilities. It seems like it's continuing on end, never on end, on this outsourcing. Even at public institutions.
They are following the dollar to the lowest common denominator, and we shouldn't be letting them. And, our president keeps saying that he's going to do something about this. Well, here we are. We're waiting, Mr. President. Let us know, and we'll be glad to help when it comes to things like IT workers at the University of California or technicians or whomever. Our work should not be going overseas, period.
And this cost shifting that's going on here, one of the issues in the contract is healthcare costs. I heard from some of the workers here they're paying 31%, or they want them to pay 31% of their income on healthcare. How can you live on that? Your members, our members.
Actually, they want them to pay 32%. And we're not going to do it. And that's part of the reason we've been bargaining for a year now. 32%. And they keep saying, well, our managers pay for it. Yeah, but their managers don't pay 32%. And we can't pay 32% because we can't afford to pay 32%. Even though we make pretty decent money, we cannot afford to pay 32% for health care. especially here in California, where the company actually pays less for health care than they do any place in the United States.
Now, the CWA has supported national health care. You support single payer. How would that affect your members, CWA members, if it was off the table? They didn't have to negotiate to cut their pay, really, to pay for health care.
Well, that's part of the problem. At every bargaining table, I don't care where it is, medical benefits is a big item, and it's a big cost to everybody's members. And single payer is the way to go. Single payer is the one thing that would make healthcare in this country what it should be. Again, the richest country in the world with the worst healthcare in the world.
And President Trump wasn't able to get the healthcare thing passed. Were you opposed to his plan or the Republican plan?
Opposed is not even close to what I was. His plan was making it much worse than it even is now. And now it's terrible. But what he wanted to do was take 24 million people off of health care. And that would have affected our bargaining even worse, because those people had two choices. They either die or they go to an emergency room. And the ones who end up paying those emergency room visits are the people who have health care, AKA our members.
And I talked to some of your members here, and they say that they can't afford to go to the doctor, some of them, because of the healthcare situation. I mean, is this the case, that even your own members here are having a problem getting proper healthcare?
I think our members, it depends where they work, but certainly the ones at AT&T can still go to a doctor, but it's getting more and more expensive. It depends, it depends on a lot of things, how many kids you have and things like that. And, doctors are expensive these days, and even if you have health care, it's expensive.
This is the first kind of regional CWA action that's been held in California. Do you see more actions regionally bringing all CWA members together?
You will see many more actions. It has passed a year as of today. We're not putting up with it anymore, and these folks are not going to put up with it.
Okay, thank you.